I'm Reverend Portia Cavett, and welcome again to For the Love of You. I am so happy that you are joining in today to learn more about strokes, and I'm happy to have with me today Nicole Cooks, RN and a stroke coordinator for Nebraska Med. So thank you and welcome,
Yes,
Nicole, for sharing with us. Today we want to look at some of the stroke statistics and those that affect African American women, and then male and female in general. And so Nicole is going to share with us.
Yes, thanks. So stroke is the third leading cause of death, which is great. We've went from 5 to 4 to 3, and now we're at 3. But the worst thing about it is that stroke is the leading cause of disability. Okay. So we're not dying from stroke, we're getting disabled. And so stroke isn't a killer, it just is disabling. And so with that being said, younger and younger people are having strokes. Okay. So about a fourth of all Americans have a stroke less than 65.
Okay. So it's affecting our lives and our ability to function properly.
To function, to work, okay, to take care of our families, possibly okay, living in nursing homes. And the average age right now for Nebraska is 42 years old.
42?
42.
So is it what we're eating or the sedentary lifestyle? I mean, what's causing it to be so young?
Great question. So 80% of every single stroke can actually be prevented by fixing those things, fixing our blood pressure, our cholesterol, our diet, and then our activities such as smoking, drug use, alcohol use, any of those bad habits. Okay. If we can correct those, take our blood pressure medication if our blood pressure's high, our cholesterol medication if that's high, healthy eating habits, exercising, will decrease our stroke risk by 80%.
Okay, so is there something in the environment that's causing people's blood pressures to go up or to start so young?
It's just our healthy lifestyle.
Okay.
You know, it's what we eat, how we don't exercise, and so then that's causing those younger people to have stroke. And they're not getting treatment. So they're not going to their doctor annually to get their blood pressure checked or their cholesterol checked.
Okay, so anytime, is it uneasy feeling? Is it a headache? Is it dizziness? I mean, how would a young person in their 30s or so know that their blood pressure is up if they don't do doctor visits?
So dizziness, feeling kind of crummy when you get up from a sitting position is good. But just going to get that check, even that simple check at Walmart or Walgreens with those simple blood pressures, you can go and check that. Some people run at a higher rate, and so they've gotten their body used to it, and so they don't even know that their blood pressure is high.
Okay, so that's a good point to bring out, to go to the drugstores and stick your arm in the little slide and push the button, because most of the time we only can go see our doctors and get a physical once a year, the way the healthcare system is going now.
Right. And, you know, I'm not saying go in just to get your blood pressure checked, but it doesn't hurt to get that blood pressure checked occasionally just to see where you're running. And if you are higher than the recommended guidelines by American Heart, greater than 120, definitely get on something to help prevent any stroke risk.
Okay, so how does it affect African Americans?
So African Americans are impacted more than any other racial group. They're twice as likely to die from a stroke.
Really? Why is that?
It's because of their blood pressure, their cholesterol, and their unhealthy eating habits, and then not going to get that controlled. So that, you know, they may find out that they have high blood pressure, but they're not taking the correct medication, or they're not taking it how it's dosed.
So is it in denial? Are they in denial? Is that what medical technology is saying, that African Americans are in denial that they have high blood pressure, or is it the fact that we're still eating high in sodium foods?
I think it's high in sodium. I don't think it's that they're in denial, but I think it's the healthy eating choices and then getting the treatment itself. So actually going in and physically getting treated, because now that blood pressure wants to be, you know, American Heart wants it to be less than 120. So in past it was 140, and so even being in that 130 range is high.
Okay, 130, That's interesting. So we've got to make sure that young people are actively engaged in physical activity.
Correct.
As well as watching and eating in moderation.
Yes.
The things that we love.
Yes, definitely, definitely. If you do have high cholesterol, it's good to take that cholesterol medication at night. Cholesterol fights against you while you sleep, and so depending on when you sleep, take it before you go to bed, and so then that helps fight that cholesterol with your cholesterol medication.
So that's a good point, because do doctors say to take it at night when they prescribe the prescription?
Now, I can't speak for every physician. Hopefully that they do, or the nurse reminds you, or even the pharmacist when you go to pick up the medication, but it is a helpful hint.
Because normally blood pressure medicine, you take it first thing in the morning.
Yep,
Okay.
and the cholesterol's kind of like the boogeyman. He comes and cholesterol fights against you while you sleep, so.
So is high blood pressure and cholesterol correlated in some way?
Not necessarily,
Okay.
no.
So what is a high cholesterol?
Anything greater than 70 is considered high cholesterol.
And so what increases a person's cholesterol level?
Healthy diet. I know I'm kind of like a record, but yes, diet. Diet is huge for your cholesterol.
So is it also carbohydrates that
It could
you
be.
intake? Or?
And salt.
Okay, so the salt causes the cholesterol
Yeah.
to go up.
Yeah.
Okay, so what type of foods? I can't remember what types of foods are high in salt, high in cholesterol.
So like chips, lunch meat, anything canned. So like your canned corn, canned soup, those are all really high in sodium.
So everything that we give from the food pantry,
Yes.
that's in a can for people who
Yes.
are low income or in need.
Yes.
So we have to make sure. Can you rinse those things off?
It's helpful to rinse those things off, and then you can drain like your canned corn, drain
Okay.
it, and put just tap water and boil your corn with tap water.
Okay.
And then you can use different seasonings too. And so instead of adding table salt, you can use like Mrs. Dash,
Okay.
or something like that, because that's low sodium.
To give it some flavor.
To
'cause
give it some
nobody
flavor,
wants-
yep.
yeah,
Or
to
try
eat
to use
bland.
more pepper versus salt,
Okay.
which I know is hard. A lot
Pretty
of people
soon
like
we
salt.
just gonna be eating plant foods.
I know, which is hopefully where we trend to, is the more lettuce and things like
Okay.
that. Because even the cooked spinach and things like that, when you put more seasonings on, can increase that.
Okay, so my sauteed spinach is
Yeah,
gonna be
so
high.
put some Mrs. Dash on it instead of your salt, or is not as much oil.
Okay, so what are some of the myths that people need to know?
Sure, that there's no treatment for stroke. So when patients are waking up with that facial droop or that weakness and unable to move, that it's not a big deal. There's nothing that anyone can do, so I'm not going to call 911 and I'm just going to move on.
Okay, so that's definitely a myth. You can indeed go in to get help, and what is it, through physical therapy or?
So actually, if you're getting any of those signs and symptoms, so that fast, the facial droop, the arm weakness, that slurred speech, or that severe headache, we want you to call 911 right away, because that's a medical emergency. And so what happens is EMS they're trained on what a stroke actually is, and they call straight from the field to the hospital. And they say, we have a possible stroke patient, and then it alerts the team at the hospital.
To be ready.
To be ready. And so we wait for you at the door. And so as you're coming through the door, our team is ready with a stroke neurologist, and we take you off to the scanner to see what kind of stroke you're having. And so from that, we can possibly give you a blood thinner called TPA, if you're within the time window, which is less than 4.5 hours. And that thins the blood to help break up the clot.
Okay.
Also, there's this new technology out there called mechanical thrombectomy. And if you have a very large vessel clot that causes very huge deficits, if you don't get it removed, you can possibly go in and get this removed by a neurosurgeon. And so those are really huge factors that can't wait for time. We can't wait till you go and take a nap because you feel a little tired, and your face will grow back after you take your nap. And we don't want you to come in by yourself either. We want you to call the 911 because they activate that team. It even delays that time if you walk into the EMS or to the ED by yourself,
Okay.
it still takes time to rally the team because we didn't get that warning that you were
So
coming.
time is of the essence.
Yes.
And the quicker that you recognize it and get in, the better off you will be.
Right.
So is there a test that the team does automatically when a person comes in with a possible stroke?
Yep, we take you straight to the CT scanner.
Okay.
And right then we're checking to see what type of stroke you have. So either you have ischemic stroke, which is the blood clot stroke,
Okay.
or if you have the hemorrhagic stroke, which is the bleeding stroke. So right then we decide, okay, if you have the bleeding, you need the neurosurgeon. If you have the blood clot, we can talk to the neurologist, possibly give you that blood thinner TPA to break up the clot. And then if it's a large vessel stroke, so a really big clot in your brain.
Okay, so it's all in the brain.
It's
So
all
you're
in the
doing-
brain.
Okay.
And
And what's the difference if it's on the right or the left side?
So if it's on your right side, you're going to have left side deficits.
Okay.
So you're going to have the left side facial droop, the left weakness. If it's on your left side of the brain, it's on your deficits are on your right. So
Okay.
complete
So it's the
opposite.
opposite. Okay, and then the right side of the brain does what versus the left side of the brain? I'm sorry. I don't remember either, but we'll make
have
sure
to
that
cut
we
that part
get
out.
that information, and we'll have a physician on to make sure that we understand what side of the brain functions, what part of our body, so that we would know and understand how we can get help or what we need to do. So thank you, Nicole. I am so sorry, but that's because I love you so much that I want to ask these questions, and sometimes I don't even have the answers, or my guests might not have it right away, but we will make sure that we get the proper information so that we can share it with you, so that you know that strokes can be preventable, but they can also be helped, and if you get into the emergency room as soon as you can.
Yeah,
Okay,
so with stroke, they say time is brain.
Okay.
And when that's being said, with time is brain, every second counts.
Okay.
So every second that you wait, every minute you wait, you lose some type of brain tissue. And our brain is completely different than any other organ. So once our brain dies, it dies. It doesn't heal and come back. It doesn't rejuvenate like our other organs do. And so every minute you wait, you lose 1.9 million brain cells.
Okay.
Okay, so that's a lot of brain cells every minute. So the longer we wait to get to the hospital, the more brain cells we're losing.
Okay, so
So-
brain cells don't reduplicate?
No,
Okay,
no.
don't
So we
duplicate.
want to save as much brain as
Right.
possible, because depending on where your stroke is at in your brain affects on what deficits you're going to have.
Okay.
So
And so
it's
that's why it's debilitating to the point that it causes a lot of people to be disabled.
right, right. So depending on the size of it, the location of it, you could lose your speech.
Okay.
You could lose the ability to write. You could lose the ability to comprehend what's written on the paper,
Okay.
to
To your brain.
to the brain to actually fluent what to read. You can lose your ability to write, pick up your children, drive a car. You may lose your vision. And so those are really, really devastating things if you're in that age bracket between 42 and 65, that you're working, you're taking care of your family, you're maybe taking care of your grandparents even, your parents, pets, anything,
Okay.
that you would end up, not being able to work anymore, to the point where you maybe even have to live in a nursing home. So then not having the income anymore of a job, and then having a nursing home bill on top of that for a long period of time, because once again, you're not going to die from the stroke. You're
Right,
just
okay.
disabled.
But you can get a little stronger as you continue to work on it, because we
Yep.
hear about a lot of people in car accidents or different things that have brain trauma.
Yes.
But they are able to come back.
Yep, and it all depends on the size of the stroke and the location. So every person is different. We highly recommend doing all the therapies, speech therapy, physical therapy, occupational therapy. And so we really want those patients to keep continuing those, because those things can come back and the brain can relearn some of it.
Okay.
But it all depends on the patient itself.
Now, what if a person does not have health insurance, or they don't have the means to do all of these things? Because I'm sure physical therapy, occupational therapy, all of that is a cost factor.
Sure.
And in our healthcare system today, some things are just astronomical.
Right. So if you're having stroke-like symptoms, we still want you to come to the hospital, no matter what. If you don't have insurance or you do, the hospital will work something out with you. And I don't know exactly, details on financial services, but they'll work something out with you, some kind of payment plan, some kind of something.
Okay, so don't let finances stop you from going
please
in
don't,
to
because it could you could really prevent any further stroke damage. And maybe you won't need as much PTOT compared to if you sat at home and waited, well, I don't have insurance, so I better just stay put. Then you may end up in a nursing home or
Okay, and
something.
so if strokes are starting earlier, can you explain the TI?
Oh, the TIAs? Yes.
The TIAs?
Sure. TIAs are called mini strokes, as many people know them. And so they're symptoms just like a regular stroke. So you might have the facial droop, you might have that slurred speech, or that aphasia even, where you say this is a table and you know it's a table, but you're coming out and saying it's a duck.
Okay.
Let's sit at the duck, and you're thinking, oh, but the symptoms go away very quickly.
Okay.
If you're having those, please go get checked by your physician. Primary care is perfectly fine.
To make sure that you tell them that you had this one episode
Yes,
or whatever.
because-
if you have no bad feeling or anything, but if it happened, at least acknowledge it
Yes,
and
because
share.
usually those are precursors.
Okay.
Okay, so they're kind of that warning, they're
Okay.
your yellow light before the red light.
Gotcha.
And so they're telling you, your body's telling you something's wrong, and so please go get checked out, because it might be one of those risk factors we need to get under control. Okay.
So that we can check. So any other information you want to share with us
So
today?
we kind of talked about it already, but stroke's not an elderly,
Unfortunately,
disease anymore. And like I said, average age is 42 in the state of Nebraska. So younger and younger people are having strokes. So just please be aware of that. That stroke happens in the heart, and we kind of talked about that too. That stroke is all brain. Okay, and we want to save that brain because it doesn't rejuvenate. Okay, strokes aren't really hereditary, is a myth, because strokes if you do have stroke history in your parents and your grandparents, you do want those risk factors looked at.
So it is hereditary. Okay.
Yep.
And how does it affect women? I understand that there are different things that in a woman's life that she has to go through. So what is our increase in possibly having a stroke?
So actually women, and this is not publicly notified or well known in the general public, but women actually are twice as many women die from stroke than breast cancer.
Really?
Yes, which is huge shock, because all we hear about as women is breast cancer.
Right.
But actually twice as many women actually die from stroke. And so it's huge risk factors that we're talking about, the same ones, but other ones that are unique to women are that we take birth control pills.
Okay, so birth control pills.
On top of birth control pills, on top of smoking. So that's a double risk.
Double, okay.
Those are two huge risk factors. So if you're doing that, please go get checked out.
Or stop smoking.
Stop smoking for sure. And then the high blood pressure and diabetes on top of those risk factors, on top of the taking birth control.
Pill.
Being pregnant, your stroke risk increases due to normal pregnancy changes in your body, but your increased blood pressure due to the blood flow to the baby, and then the stress on the heart. And so that can cause blood clots to go to your head. Using hormonal replacement, so progesterone or estrogen to relieve those menopause things. Men don't have those issues, and a lot of women are taking those earlier than in the past, and so those are big ones. And then suffering migraine headaches. Migraines can increase the risk factor for women.
Oh my goodness.
Yeah. And so those are really, really big things, and that are unique for women.
Okay, so as women, we really need to take care of ourselves and reduce the stressors that are in our lives. It's okay to be the woman that you are and to be pregnant
Oh,
and to
absolutely.
be on birth control pills if you so desire, or if you have gone through a hysterectomy and on hormone replacement. But you have to still take care of yourself. You still have to make sure that you are healthy, that you are eating right, that you are exercising, and keeping the stressors down. As a woman myself and in a stressful profession, I have to make sure that I take time out for myself. Go get my hair done, just relax. Go get my nails or a manicure, or even to have a massage.
Yeah.
Have to have some time of self-care so that I can be a total healthy person and relax my brain. I like
Yeah.
to think that if strokes affect the brain, then that means I've got to relax. I got to tone it down, stop thinking so much, stop taking on so many other activities or other people's problems,
Yep.
but take time out for myself. So Nicole, we really thank you for coming and sharing with us today, that we would understand that strokes can be preventable, but they can, the medical staff has worked it out where they can help you overcome or even work through a stroke. And so today, if you have any questions, we invite you to contact us to share that and whatever topics you would like for us to cover. And we are looking at going in and talking to physicians and other persons to make sure that we get the information out to you, because we want you to know that we indeed care. That's why we entitled this show For the Love of You. If the number of stroke victims or persons are 42 and younger, then we need to make sure that we're reaching out to the average young adults so that they would know that their health is important and that it's not an older person's disease any longer, that it's affecting each and every one of us. So let us be healthy. Let us do the best that we can with the life and the body that we have been given. Take time out to enjoy life, but to take care of yourself. Anything else that you would like to share?
Just remember those signs and symptoms: facial droop, arm weakness, slurred speech, and then T is for time. Call 911 right away.
So remember, you've got to be fast and to make sure that we are indeed taking care of ourselves and looking after those that we care about, our family members, our elderly parents, even our co-workers, our friends. We ought to make sure that we are sharing one with another. The person that you exercise with, we have to be looking out. If one person is getting short of breath, take some time out, drink plenty of water, just take it easy. But if you have any pain, any numbness, any drooping, that you call 911. That was so important to hear today, that the medical staff in the ER is ready with the information and the technology to help someone along the way. So let us all do the best that we can for the love of you. Until we meet again, thank you for joining in today, and see you next time.